my next question here is that is the scarring problem in women also the same like men?
Many of us have the belief that women, they are less affected by heart diseases. So I would like to ask the audience, what is your opinion? Those who say that women are less affected, can you raise your hands? And those who think that men are more affected, you raise your hands. So those who vote for women, please raise your hand. मैन में ज्यादा होती है हार्ट डिजीज या वुमेन में? मैन में। जो मैन बोलते हैं हाथ खड़ा करो। So maximum people think that women, they don't have heart disease or they have less heart disease. लेकिन the real truth is कि women, they have more heart disease and more women die because of heart disease compared to men. Every year 58 million people die across the globe and 1/3 of these die because of heart diseases, almost 18 million now. And if you compare with cancers, only 13% deaths are because of cancers, while 30% deaths are because of heart disease. I will show you a video, and this comes true in many cases. This is how a housewife has to work to keep the house running. And nowadays, women, they are working also. So you can imagine how much stress they have to cope up with.
Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her shoes. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas.
So most of the women, they are not even aware that they are getting a heart attack, because women don't typically have the typical symptoms of chest pain. Even in many women, there can be a silent heart attack, or they may be having headaches, or they may be having some weakness, some uneasiness. and they are not able to correlate. And many times, even if they consult a good doctor, a good cardiologist, and the diagnosis may be missed. But even if the diagnosis is made, if we tell a woman that she needs some intervention, she is most likely to postpone the intervention or not to get the intervention done immediately on some pretext or the other. लाइक अभी बच्चों के एग्ज़ाम चल रहे हैं, अभी ये फैमिली में थोड़ा प्रॉब्लम चल रहा है, तो शी कीप्स ऑन पोस्टपोनिंग द ट्रीटमेंट. सो दैट इज़ वाई इवन इन US 50,000 more women die because of heart attacks every year compared to men. So now cardiology in women has emerged as a separate subject because during reproductive age different diseases occur. There is eclampsia, preeclampsia, pregnancy-induced hypertension, diabetes, and so on. And later on, in the post-menopausal period, there is an accelerated occurrence of coronary artery disease, heart attacks. So you have to also remember that obesity is more common in women, and if a woman has diabetes, then the risk of getting heart disease increases at least 3 to 7 fold. So which is very alarming. If you compare to men, diabetic men, the risk of getting heart attack increases by 2-3 times, but in women it increases up to 7 times.
That's an alarming number.
Yes, and many women are not even resuscitated. So you understand what is resuscitation? Like if a woman collapses, so people are afraid to resuscitate a woman, and even in the Western countries, they found that less women are resuscitated. Probably the reason could be that people are afraid that they might have to face a litigation about some inappropriate touching of the woman. So they are afraid to resuscitate a woman. So this is very alarming because we have to raise this kind of awareness in the society that everybody should be aware about how to resuscitate a person when a person collapses. So in Western countries, even youngsters, they are taught how to resuscitate, and in colleges, schools, everybody, it is mandatory for everybody because it can happen anywhere in your campus also. It can happen on the railway station, airport, in the market, in the malls, anywhere it can happen. So if you know how to resuscitate, you can revive the person, because a person can die within 5 minutes if we don't resuscitate, because the circulation to brain is gone and the brain dies within 5 minutes. 3 to 5 minutes is sufficient for the brain to die. So we must learn how to resuscitate.